morning, listeners. Good morning, viewers, to the Real Stuff podcast. Today we are on the topic again, mental health. And we are very, very glad that you could join us. Today I have my co-host Courtney, and we have two very special guests. We have Dr. Deone Curling, who is an expert in this field. And Zaid, I'm told, is a practitioner in this field. And Queen Angela is about to enter with us.
Oh, okay.
Let's give her a second to come in. Good morning, Queen Angela. Could you unmute? Unmute, please.
Oh, good evening.
Good evening.
Yes.
Good evening.
Good morning. Almost midday, you know. Okay. Courtney, you want to lead it off, please?
Okay. Well, good morning, good evening, good afternoon, wherever you are in the global space. Yes, we are having on the Real Stuff podcast today a discussion on mental health, and we are with us Dr. Deone Curling out of Canada, and Zaid out of Canada, and Angela Rugara out of Zimbabwe as one of our co-hosts. So today we'll be discussing mental health issues. And so we'll just ask Dr. Curling to lead us off. And what was she as, to discuss with us today?
Right. Well, thank you so much for having us and having me. I really appreciate this. Mental health is such a crucial thing. I think it's the most important thing. Maybe I'm biased because that's my area. But I think if you don't have mental health, then you don't have anything. And it's interesting how we don't know too much about the brain, or people are scared of what's happening in the brain. But if we understand how our brain and what's happening, we'll understand how our whole body functions and our well-being. So I think it's important we have that. I'm so glad that we're having this discussion, especially I'm really looking forward to speaking to Zaid as well too, because he talks with youth. And I think mental health in youth is so important that usually is ignored. We think it's maybe like, what do the young people have? They have nothing to worry about. But I think the worry and the concern that they have is so important, and they need a space to speak and express it, because then they hold it. And it manifests when they come, it doesn't disappear. It comes out when we're with adults and haunting the individual when they're adults, and how they connect with everybody around them. So I'm glad we're having this conversation, especially during this time that we're coming from all different parts of the globe, but we're all experiencing COVID in different ways. But I think, if I be presumptuous, I think our mental health is really affected by COVID. That really needs to be talked about. And I'm so happy we're going to have that discussion.
Okay, Zaid, can you just pick up? Because especially we know that you deal with youth, and one of the situations that I think, affect youth a whole lot is ADHD. So, in your brief talking, can you just talk a little bit about that too?
Yeah, definitely. I have just a little bit of introduction, background in acute psychiatry and clinical care, in inpatient hospitalizations and outpatient, and within the community in Canada. And, youth has changed in general. I would say, there was a time when youth were looked at as 16, 17, 18-year-olds, teenage, adolescent. And that generation within the world of society has kind of changed what the definition of youth is. And now we more look at youth up to the age of 30. And that's given on societal challenges, difficulty in gaining the independence and financial independence that they need, and needing resources. So that's one perspective that's kind of changed, I would say, over time. And specifically to answer your question in regards to ADHD, in Canada, a lot of times ADHD we see affects kids in their academia, so their school performance. We can see it affect them in their ability to initiate and maintain relationships with friends, but usually it's supported by medication or therapy. So that's usually what we see as resources that people use here in Canada to kind of support individuals and youth with ADHD. And then, you know, specifically kids with ADHD are looking at attention hyperactivity as a disorder and needing a lot of, I guess, variables within their day to help them to kind of focus and keep their baseline of needing lots of stimulation externally. So one of the things, you know, parents can do as well, or caregivers, is provide activities, you know, that kind of support that child's growth and to understand and get more psychoeducation around ADHD and how that impacts the child.
Okay, at this moment, I'd like to introduce Angela Rogaro out of Zimbabwe. Queen Angela, can you just give us a brief? And if there's any question, you can just ask it during that time too, please. Queen Angela.
I'm muted.
I'm sorry. I am a retired mental health nurse. I worked as a nurse ages ago. I just want to mention some of the few mental health problems that we faced in Zimbabwe. Most of them has been depression, increased gender-based violence, child abuse, drug abuse, and also prostitution amongst children, and a lot of suicide amongst young people. Those are some of the problems that we've encountered. As regards to ADHD, in Zimbabwe, we don't have what I would call a very elaborate psychiatric support for our children. Mental health is something that is talked about under the table in most cases, and diagnosis is not done properly unless if a parent, you know, is financially secure or able, then they can get their child, you know, get proper diagnosis and proper support or treatment.
Yeah, so back to you, Dr. Curling, in a bit. Just to ask a question though, what's the importance of diet in mental health? Or how do you think dieting, you know, aid mental health?
Well, that's an important question, and I'm not really an expert in about the diet and mental health, but I do see and do talk to clients, and my own experience too, is that our foods affect our bodies. Food, like so maybe you have too much caffeine, let's say, maybe too hyper and unable to sleep. If you're unable to sleep, for me personally, sleep is the most important thing for every single type of diagnosis or in mental health. You need good, proper sleep. And so when you're having like too much caffeine, that happens. Too much sugar as well too can affect, you know, the way you respond, how it feels in your body, and then how you maybe more irritable, more hyperactive, you know, unable to sleep. So those are like the things that manifest mentally, you know, that we have to be aware of. Okay. So it'd be good to have, it'd be interesting to have some naturopath or dietitian that specialize in food and how it affects your mental well-being. That would be interesting to have somebody on to talk about that. But yes, of course, I see it that diet does, and so we have to monitor, like, let's say with children now, everything is in sugar. Even if you're trying to say not to put sugar to give your child sugar. It's like they put sugar in every single thing. You read the label and they call it some fancy name, and it really is sugar.
Yeah. That's what I was gonna get to, because
Yeah.
you see they hide it with aspartame. There's so many different names that they use, for sugar, just like how they do MSG.
Yes.
There's so many different names.
Exactly.
And because the lay people are not really knowing these terms, don't find it significant.
Yeah, exactly. You feel like you're doing the best for your child, that, for example, and you're feeding them food, and you don't and saying we're cutting out the sugar, you're not giving them candy, but you don't realize, like, let's say the bread is so much sugar carved in that.
Yeah, bread. Can you imagine bread?
Yeah. So you're trying to help, and the children are, let's say, getting so, let's say, high on the sugar, and you drop so low when it's off. It affects your mental well-being, affects the way you interact with other people, affects your mood.
So tell me something, Dr. Curling. Is there a correlation between obesity and mental health in children?
Well, there has been connections to that. So I can't say it's just that, but also too, like, that's so huge. Maybe I could even speak about that more with the children. But lots of time I find in the Black community, we soothe ourselves with food. So you maybe say stressed, or a child is eating to try to get some kind of comfort, right? Some way to just escape, which then gains, and usually, again, it goes back to the sugar. Usually it's carbs that people will eat, like breads, or, eating ice cream or different things like that will soothe you when stress to come out, when maybe it'd be helpful, like, to talk to someone or go play basketball, or finding a healthier way of soothing. And so that type of soothing might be beneficial in that moment. You feel better, you get to escape by eating the pizzas, let's say. But in the long run, the weight and the obesity, and now diabetes is an issue, especially for very young people, and it becomes an extreme problem.
Where do you throw staying indoors in all of this? Video games and all of that.
I don't know if
you're going outside.
Yeah, well,
to run or play.
See, I live in Canada, and we have winters. It's cold outside, but I'm a big advocate. I don't care if it's a snowstorm. I don't care what it is. You're outside every single day. You need to get the sunlight. So when you're in warm countries, let's say, it's nice that you have the sun and you need to get out and run around. But I feel, especially in Canada, we have so much of the darkness, and then we stay inside more. Because it's cold outside, the weather's not good, but you still need to get out, need to move around. But it's so easy, especially you say, oh, it's too cold out there, sitting with the video games, hours go by, not moving your body, not seeing sunlight, plays havoc on your physical and your mental well-being. And I think with video games, I think, Zaid, maybe you could speak about that with children and video games. I know.
Yeah.
So Zaid, that's what I was just about to ask you to join the conversation.
Yeah, no problem. And definitely, like, we do see that video games and kids kind of resorting to engaging with each other through electronic devices as their way of kind of sharing experiences has kind of been so prevalent, and kind of the only way that kids now are having difficulty interacting with each other in person. Kids are having difficulty now interacting a lot of times and developing social skills, and also really understanding how to manage their time. It's a lot easier when we were growing up and we didn't have the opportunity to engage with each other through all these electronic devices, but now kids do. So it's 24/7. Another point to bring up that we've seen as a big problem with young people is their inability to know how to turn it off. And meaning, you know, at a long day of work, or when we left school growing up, we were able to stop some of the conversations, stop the interactions, process what we're going through in life, and kind of have some space to grow ourselves and get to know ourselves. And young people now with Instagram, social media, there is no stop or pause. It's 24/7. So kids are having issues at school, and it carries on after school because of social media into the night. They're not getting any sleep. The issues are continuous with actually no end because of technology. So kids don't know how to manage and how to disengage once they're engaged. And it is causing a lot of, it's not, I wouldn't say creating, it's creating new issues, but more so it's exasperating issues that were already kind of part of our society with young people. So
where does the parents come into all of this?
education is one, because you want to know how to use technology yourself so that, you know, you're not assuming and baseless in your understanding of what a young person may or may not be able to do with technology. So understanding how Instagram works, understanding how TikTok and all of these things that kids are using works, and then having a relationship with your young person that, you know, is based on open communication and transparency. And ultimately, it's a young person's choice to involve you in their life once they get to a certain age and to disclose, you know, what they're going through. And you want to be able to support them, but they first have to feel comfortable to not feel judged, you know, which is hard to do as a parent because we have our own expectations. But that's, you know, parents' best resort is to have open communication and then to provide those other alternative outlets like other activities, other, you know, ways to utilize their time.
Yeah. Oh, okay. Go ahead, Queen Angela. Sorry. Go ahead.
I would like to take us back to obesity. Because these indoor games also cause obesity, because it will be eating, playing, and people don't, you know, youths or young babies or whatever, they don't have enough exercise. And when they do go out, if they're forced to go out, then there's a lot of teasing because, you know, you're too fat, you are this and that, and there's also a lot of bullying seen in kids with obesity, and they tend to get also depressed. And because their foods will be high in sugar content causes bowel syndrome. The sugars feed the wrong bacteria in the gastrointestinal system, which also cause them, you know, a lot of problems, including constipation, because the foods that they'll be eating will not be healthy foods that help them digest and have proper bowel movement. And also the high sugars cause mood, you know, the sugar rushes and, you know, the irrational behavior in children. And, you know, they end up being abused by their parents because they are children who don't listen to instructions. They are children who think they're independent because of what they learn on the video games. And, you know, it's a whole lot of complex issues that emanate from, you know, just staying indoors without mingling with other children.
Yeah, Zaid, I just want to go back to a point that you were making about, you know, social interaction of children due to the staying inside and playing these video games. What do you think? Because they're not like in touch personally with other children. So what do you think the problem is? You know, like, because they won't be developing a certain level of social skills or social interaction. Oh, and you know, how can we correct this also?
Well, I think it comes back to the relationship and the open communication and not putting the entire accountability on the young person to identify what their interests are in life. I think in our culture, especially Caribbean culture, that's my background as well. And in the Black community, there's a lot of responsibility on the young person and expectation to understand themselves and be able to express and communicate their needs very soon in life. And that maturity is kind of expected. A lot of times based on the situation at home to have to support the family structure. So I think in that, the best way for parents to really adapt is to get to know the young person, get to know why they resort to utilizing the technology the way they do. What's the gain? What does it provide them? Is it a way to, to feel better about themselves because they're good at the game and it gives them confidence? Or, is it a way to get away, from everybody and to wind down? And I think once you kind of identify the gain, what the investment is for, and what they get out of it, then you can start to kind of create some alternatives for the young person that provide that same gain and result, right, for them. So.
Yeah, I think that's a really good point. And I think of what you said, Zaid, before too. I think one thing we have to realize that children don't know how to, or young people don't manage their time. And not even kids, even myself, like sometimes I'm like on the phone's right here beside me and I'm on it, I don't know, Instagram, and you realize hours go by. It's like, oh, how did that hour just go by like that? And you say, okay, I'm going to stop scrolling. And something that's so hard to stop. And I think it's to learn to manage your time. I think, and also to have a balance. It's like not to take it all away, but it's like to say, okay, what gain do they get from it? To get it, and maybe you do it from this time to this time. And then there's other things to do as well too. If we can learn how to balance in helping, our young people.
So in effect, Dr. Curling, you're saying that we have a new disorder called social media disorder?
Oh no!
Well, they do call it gaming addiction out here. They do have programs for game. They call it gaming addiction in Canada, and they have programs for young people whose parents say the kid is online 14 hours a day, won't engage in school, essentially can't provide daily functioning, at their age level, and that's when it becomes an issue for parents. And Canada's, I think the world's slow to it, but Canada does have programs, not offered widely through the government, but they do have, kind of specific or private programs that offer young people some therapy around gaming addiction.
Yeah, because I really do believe it is an addiction, and I think it needs to be treated that way for some people, children.
Yeah, some people can't step away.
Yeah, and that addiction is not in children only, it's also in adults, because you go into some you go into some homesteads, father is on his gadget, mother is on her gadget, and the children are on their gadgets, and who controls who?
I know. And sometimes we have to catch ourselves, because I can see myself, my son is on his video games all the time. And I would be on my phone, let's say, and telling him to get off it. You're on it too much. And I'm still on mine. So sometimes you gotta check yourself, like, can you put it down? Can you tell him to put it down? Are you able to do the same thing you're telling your kids to do?
Yeah, but a quick open question though. So how can you diagnose these children with ADHD when they are paying so much attention to the social media and their games?
Well, I think ADHD is, first you have to understand what ADHD is though, and how to get that type of diagnosis. Very complicated too. Like they have to have like 6 symptoms of hyperactivity and 6 symptoms of inattention, right? So, and in 2 different places. So they have to be doing this, let's say, they're having problems at school and at home. So it's very complicated way of, you know, for them to, it's a long assessment. But also remember, people say, well, he doesn't have ADHD because he's able to be on the video games all day. But they're moving all the time. There's activity happening all the time, right? So it doesn't mean because they're able to sit and do video games for a while that they don't have it. But it's, I think we use the term so loosely that we have to be careful. Just like even like depression, we use it very loosely, like everybody has depression. Every child that doesn't sit has ADHD, you know. So
we're talking about children though. But what about ADHD in adults? Is it because they're taking it over from childhood into adulthood, or they can have it during their adulthood period?
Really, what I know is that they usually have it at childhood, but it wasn't diagnosed, and they're still having the same. Looking back, they had these same kind of problems in childhood, and now they're having it in adulthood. But lots of children who have ADHD, when they get older, the hyperactivity comes down a little bit. Their attention is maybe off, but they're not so hyper because they learn to socialize, I guess, but they still have it. You find, like, let's say at school, they didn't do well in school. It was hard for them to focus on the assignment, for example. And then now it's hard for them to get a job or stick with the job, always switching a lot. But so usually when you see a person who has ADHD at adulthood, they probably had it in their childhood and it wasn't diagnosed then.
So what about the matter of impulsivity? Because I have quite a few female relatives that you can't take them to a store.
Okay.
You know what I mean? If you take them into a clothing store, you'll be maybe spending all day there.
Oh, because they love to shop at the clothing store? Maybe the shop.
I think all women do that.
Yeah, I think I have that too.
No.
Again, you call me ADHD.
I think some of these women just have this impulsive thing about them, in a store, and I don't know. I'm trying to figure it out. Even adulthood at my age right now.
Well, I think we all have some kind of disorder, right? We could put a label in it, but then but is it a label? Or we become, maybe your nieces or whatever are impulsive and want to shop at the store, but where are you impulsive? You never know where that might come out for you.
But then it's sorry, go on.
No, go ahead. Go on. No, you go ahead.
I was going to say, in adults, it's not just the impulsiveness, though. They also have disorganization and problems in prioritizing, and also poor management skills, and they've got problems in focusing on tasks.
Yeah.
It's more than just being impulsive.
No, I agree, because sometimes you're thinking, I have to do this, I have to do that, I have to do this. Oh, you start doing something. Oh, I got to add this too on it, and then I'm doing that.
That's right. Yes.
You're trying to get so many things done at the same time. Where does it go? Just trying to manage it yourself. Do we call it a disorder? No, we're just trying to survive.
And they also can multitask.
Yeah.
Despite wanting to do many things.
Exactly. And to survive, women can multitask. That's the only way you're going to get things done.
That's right. And also there's poor planning.
Mm-hmm.
And there's also low frustration tolerance. So, so Courtney, it's not just impulsiveness.
Yeah. But what I hear you're all explaining to it, it sounds like it's showing certain levels of anxiety.
Go ahead. No?
Yeah, because I've seen when people in that kind of situation, they get very anxious, because I got so much things to do, and I don't know, but I don't have enough time, and they start develop this kind of anxiety.
Right. Yes. Well, I think one thing is we all have anxiety, and you should have anxiety. Anxiety is, we need it to keep ourselves safe in a way. Like if the bears kind of chase you and you don't have any anxiety, you're just going to sit there and let the bear come after you. Well, there's something wrong. So you need to have a little bit of anxiety. But when it goes overboard and you can't function, you know, you're so anxious that you can't even do anything, then it becomes a problem. Like anxiety gets us to do things, but then also too much anxiety can make us freeze, and that's problematic.
Yeah.
But it's to be able to, I think, big thing is to manage our time, to learn how to manage our time, because you can feel so overwhelmed and anxious by it. One thing I do, I think is so important, especially for kids who have ADHD, for everybody, is have a routine. You know, knowing, getting up at a certain time, doing a certain thing at a certain time, this knowing what's going to happen next, going to bed at a certain time. That's one thing. Sleep is so important. Sleep is what resets us for the next day, you know. And so if we don't have that good sleep, we're going to be maybe more hypervigilant, let's say, or hyperactive, or don't have any energy, depending on how it manifests. But I think a routine helps, you know, in so many ways in your life. A lot of times we don't have a routine. And I think also going back to the COVID stuff, let's say, COVID took out the routine and really made us, I don't know, maybe kids being on the video game from morning to night because they didn't get up to go to school, let's say.
Oh, so it's taking us into this kind of robotic type of living, eh?
Yeah, like, oh, you get up in the morning and then, oh, the day is done. You didn't do anything or whatever, you know, or you didn't leave the house for a week or months. It's not what, before we would at least like get up and we had to get out the house, let's say, and go somewhere and then come back. That really helped our mental health. I don't think we even realized how much it helped.
So Zaid.
Yeah.
Yeah. Talk a little bit about the testing and evaluation of ADHD, if you can.
So I wouldn't be that would be more actually Dr. Curling, who could provide you with the psychological assessments and kind of the information in regards to the assessment of the ADHD.
Yeah, well, the assessment ADHD is very complicated and it's different batteries of tests, and it needs to be discussion with let's say with children, what's happening at the school and what's happening at the home. It's a whole process in order to come to a diagnosis of a child having ADHD. And sometimes some children have more of the inattention, and then maybe less hyperactivity, or more of the hyperactivity. You see more of the hyperactivity, let's say, if I'm generalizing, in boys than in girls, and more of the girls, more of the inattention than the hyperactivity. But when they get older, they say like about 17, 18, usually the hyperactivity comes down a little bit. So and then you really don't really see the difference between men and women. They both have the diagnosis with ADHD, how it manifests, similar.
Yeah, because I'm looking at it that it's supposed to be a very difficult test, because suppose the person's personality that is like they are introverts or extroverts. You know, how do you because their personality must have been fitting into this kind of assessment and evaluation.
Yeah. So you're asking lots of questions, and you're following a pattern of behavior for a while, and then see, is it like you have, like, sometimes, like, let's say boys, like, I shouldn't say boys, but let's just say boys, if I'm being stereotypical, expect them to sit in a classroom all day and follow instruction, and they can't sit in the classroom. Doesn't mean that they have ADHD. Is it really natural? Really, maybe they just have more energy. But then doesn't mean that, they have to be extroverted type of personality. It's just that it's very difficult to sit still and focus on something for an extended period of time.
And I will add to that too. I think like the main defining factor in all of mental health, whether it's adults or young people, in identifying a need to be assessed on any level is when your daily functioning is declining or disrupted or inexistent. It's not happening. And until then, even if you know, a young person who later in their adulthood was diagnosed with ADHD and wasn't when they were young, their childhood could have very well been amazing, and they could have very well been successful at everything they did and not needed that diagnosis because they were functioning well. And that's why it's important in mental health for parents to not become fearful or to you know, look for a diagnosis as a reasoning, and more so as just an identifier and a support, you know, and an informative kind of resource, because diagnoses also change, and diagnoses can be indifferent in terms of the doctor who you go to. So I see that a lot as well in hospitals, where a child may come in with a specific diagnosis and the other psychiatrist does not agree with the diagnosis that they came into the hospital with, or the medications that they're being prescribed. You know, so there's still that autonomy in healthcare. And the best thing for you to do is to take it with a grain of salt as a parent. You know, if a doctor does give your child that diagnosis, to get a second opinion, to observe, to not take it as a life sentence, and you know, and there's a lot of stigma around that as well. But that would be one thing, is like, there's no real need per se for assessment of anything if a kid is happy and enjoying their life and functioning well and thriving, regardless of their presentation of, they like to do 1,000 things a day. Well, if they're getting A+ and treating everybody well in the family and happy with their life, who cares, you know, that they like to do a million things and that they don't like to pay attention, they're functioning. So it's more when you start to see a decline or difficulty in achieving happiness or contentment and such. So
yeah, that's a very important point, because one of the specifiers is are they having a difficulty in life? Their daily life is not, they're not functional. You know, it's becoming problematic. If it's not a problem, then don't worry. And sometimes like, it's good to have that energy to do things, let's say.
Yeah, there's a joke they say in the hospital. You know, what if we were to diagnose all the doctors in different departments? You know, what would an ER doctor be? What would they have? And they always say, obviously, ADHD. But they're a doctor, they're successful, they're functioning, and most of them would agree. If there was any diagnosis to place, it'd be that, because they're the doctors who like the variation, 100 patients, moving miles per hour for their 12-hour shift. You know, ER doctors, it's a different personality, as you said. And that's why it's, you know, the diagnosis is not always necessary, because if that's the personality, it may allow them to be an ER doctor versus a doctor who doesn't have that ability. So sometimes we look at, you know, these experiences that can be labeled as negative or limiting, but they're not. Sometimes they provide more and exceed limitation. A lot of lawyers and scientists who I know of have been diagnosed with OCD. Right? So obsessive compulsive disorder, and they're the best lawyers. They're the ones who read every word. They're the ones who can invest the most focus in getting the case solved. So, you know, when you look at a lot of successful people in the world, Elon Musk as well, he, I believe, I'm not too sure what his diagnosis, but I believe he has Asperger's, so he's on the autism spectrum, and he's, again, brilliant. And you see a lot of brilliance with people who have Asperger's or high functioning autism. So, so that's another way to also perceive, you know, the experience of your young person, right?
You make a really good point too, because I think we should look at mental health diagnosis as how does this person learn? And I think we all should find out, how do we learn?
2008.
You know, what are we looking for? And so it's like, maybe the person needs more activity and they learn better. You know what I do, I switch the numbers. If you give me the
website.
Oh, sorry. If you give me the, I think his name. If you give me, like I have dyslexia with the numbers. Give me your number, I'll switch it around. So I know slow down and I switch back the number.
WHOIS.
So learning how to.
WHOIS.
What's the best way? How do you learn?
IS, yes. Yeah. Or WHO.is.
Flavius, please.
Yeah, try that.
Flavius, you're coming through on the Zoom.
Yeah, put in that in the bar and you see it come up and you click on
Flavius, you're coming in on the Zoom. Unmute. Yeah, go ahead, Dr. Curling.
No, I'm just saying that I think all of us should find out, how do we learn best? How do we navigate the world the best for our own self? And a diagnosis could help. Like maybe you need your type of person that needs more activity. Like I say, like, and you do well being an ER doctor because there's a lot of things happening at the same time, you know. Or maybe you're best at being, you know, OCD is really good for you because if you have OCD, you look at each of the little detail and make sure it's done right, and you look it over and look it over again. So that's the way you navigate your world. And if you can use it to how to work with it can help you. Not that seeing it as, oh my gosh, it's using it against me. If it is, and it's problematic, there, you know, is that how can we make it a way that is more balanced? Maybe medication will help. Maybe doing therapy, or even the both. But how you work with the, let's say, the diagnosis or the in your life can help you move forward.
So Zaid, a quick question though, because you know this just came to me. What about a child who think that like, you know, school is boring, or because he's not challenged, you know, because of this, you know, new technology?
So again, it comes back to identifying the relationship. You know, in our culture, I would say again, there's not much opportunity or room to have these types of conversations a lot of times with our parents. And I think you need to identify with the young person, why is school boring, right? They may not know why they're not invested or disinterested. And a lot of times you're right, it could be because they're not challenged, or it could be something else, insecurities, you know, things they're going through. So I think to what you were saying, if it is because of technology and because they're not challenged, then, you know, find out what challenges them. I think the big piece here again is parents not realizing that they have a responsibility in supporting the young person to develop skills to identify what works for them and what they need in life. It's not innate. It's not something that you just kind of know. You do need help to kind of develop that as you get older. So I think that would be the most important thing. And then supporting them, engaging in like those resources or the classes at school that provide that challenge for them. If the school doesn't, you know, we can't depend on the education system. You know, we would have to then provide them with private activities that challenge them, or find a tutor, or, you know, start to onboard them onto the next year's academics, you know, because those resources are usually available as well. So there's ways that you can support your kid to thrive if they're not being challenged in school.
No, because I remember like many, sorry, just 1 minute. Many years ago, I had this, you know, Neville, like, 20 years ago, when he was like getting into high school, he felt that he was much brighter than his teacher. Mm-hmm. You know, he said, oh, school is boring. The teacher, you know, she can't teach me anything that I did not know.
Mm-hmm. Did his marks reflect that notion though? Was he a straight A student?
It does.
Right.
He probably was right.
Right. So then what you would do as a parent is you would approach the school and advise them of this. What happens to kids? Like in Canada, they have gifted programs. They have schools that you can transition to if your child is above board in terms of their intelligence and not challenged. So they can go to schools that are appropriate for that level of intelligence. Obviously, you know, depending on the country and the resources, sometimes these things are not available. But in Canada, that's what they do have. So they do have specific schools where kids who are so overachieving and gifted go to, and it provides them with like a pathway to like mandatory scholarships, you know, kind of a pathway to success in working as a citizen to give back to society. So you end up being like scientists and doctors, and it kind of paves that way for those kids who are truly really exceptional and have those gifts. Past that, what you can do with a young person who's not challenged in school is start to engage them in entrepreneurship. If a young person is able to achieve so well in the educational system and feel like they have nothing to do afterwards, then why not start a business in the interest or this skill that you excel in, you know, and develop entrepreneurship while you're going to school, right? And start a business. So there's, you know, there's different things, there's guidance that's still needed from the parent. How does the kid use these skills?
I liked what Zaid said, that we need to look at what a child is going through. I once came across a child who was diagnosed as having ADHD, but the child came from a very poor background, very strict parents. So when he came to school, it was an opportunity for him, you know, to be excited and, you know, do things that he couldn't do at home. So he could never sit still, you know, until someone said, you know, can someone investigate where that comes from and what is happening at home? And it turned out that, you know, he was like that because of where he came from. Not that he had, you know, mental health problems.
Yeah, exactly. You have to look at the whole picture of what's happening with the child, with the person.
Great, great. Thank you very much. I think we have come to the close of the program. And thank you very much. One more question for Saido. How can you assess your intervention with the kids?
So one is, you know, we come from a practice where we don't lead, and leading means when I go to speak to somebody about their life experience, I don't lead with my assumed result, which is a lot of parents will go to a kid when something happens and say, oh, are you hurt? Or are you sad now? And the kid hasn't even answered yet, and you're already leading them into nodding their head, they're sad, because that's what most young kids do. So you're teaching them the emotion that they should have for a specific experience. And it's also, you know, we learn that as well through watching our parents, right? Bills are due, they're stressed. So we learn kind of how we should respond to situations. So, you know, specific to what you're saying, I would say that, you know, that's the best way for you to kind of figure out how your child and you can adapt healthy responses to difficult situations and to dealing with distress.
Okay, can we have everyone with the final words, please? And then I'll ask Queen Angela to close off for us. Start with you, Dr. Curling.
Oh, well, thank you. I guess, like, I think what's important when we look at mental health is to be open to taking care of our well-being and understanding our mental well-being. And so we can understand what is best for us. Maybe if I take too much sugar, that's not good for me. It makes me too hyper, I'm unable to sleep, which affects my my well-being in the day. Maybe I've had to find better, instead of eating foods to comfort, is maybe to go out and talk to friends or go play basketball. Different ways that we can manage our well-being and not be afraid of mental health, but embrace mental health or mental well-being, will help us help our whole being, and especially with the people around us.
Thank you. Zaid?
I guess just final words would be, I would just encourage parents to, no matter which country you're in, and I know, society is different everywhere we are, but to really focus on building a relationship with the young person that you may be concerned about or not concerned about. Your children, kids in the community, and giving them an outlet. I think a lot of young people feel suppressed, feel judged. And I think a lot of young people also in today's society are also not really having to take any accountability and responsibility. And that's kind of the other flip coin that we didn't get to discuss. But, for parents not to become enablers, when we are trying to push and challenge our young people to do better and guide them, not to a point of fault where we're working harder than them. We still want to instill independence, and we still want them to demonstrate their ability to kind of self-nurture and independently soothe or resolve situations that they're in. So that would be my give back.
Thank you. And Queen Angela, can you close for us now, please?
For me, it's about a holistic approach into health, where to be physically well, you've got to be mentally well. To be mentally well, you've got to be physically well. And the diagnoses are not just on face value, but to take a holistic approach as well, the background of the person and also the people they are interacting with. That's my my closing remark. Thank you.
Thank you very much. So as we close, we thank our listeners for listening and viewers. And as we close this mental health, I'll ask Queen Lubafu to give us the Our Father in the Garifuna language, and Tafina to take us out. Thank you again.
Thank you.
You lead us to Fula. You belong far away away. Ajugwala lebo buseru. Lida mua, lida sungfula. Lida mua, lida sungfula.
Well, unfortunately, this is it. Till next time. Bless.
All you gotta do is just speak. One word is enough, and I'm no longer so rough. I forget what I was trying to say. I no longer do what I was gonna do, but you're no good for me. That's why me know what set me if it could flee. Me I fi take away me say.